Hi, I'm Dr. Qadri, a neurologist and co-founder of QWorld.Ai. Let's dive into a fresh step 1 question. I'm going to create a new quiz. There you go. So this has 5 questions. A 25-year-old male presents to the emergency department with a fracture of the midshaft of the humerus following a fall from a bicycle. On examination, he has difficulty extending his wrist and fingers. Which nerve is most likely injured in this patient? So midshaft of the humerus, and now he's having some difficulty extending his wrist and fingers. So the extensor muscles are typically supplied by the radial nerve. So let's look for the option. There you go, radial nerve. Submit the answer. Awesome. So the radial nerve runs in the spiral groove of the humerus and is commonly injured in midshaft humeral fractures, resulting in wrist drop due to loss of wrist and finger extension. Let's click on some AI insights so we get some more detail. In the meantime, let's look at the other options a little bit. So the axillary nerve, that's typically injured in shoulder dislocations and fractures of the surgical neck of the humerus. And that can cause weakness over the deltoid and sensation over there. Ulnar nerve, you'll typically see in the elbow, sometimes in the wrist as well, in the ulnar tunnel. Median nerve as well in the carpal tunnel. So here's a more detailed explanation on this. Here's a small learning aid. Let's look at the images though. So radial nerve entrapment, there you go. It can happen at the midshaft of the humerus, right? And then we have another one about the symptoms of radial nerve injury. See inability to extend one's fingers. That's definitely a part of it. Radial nerve palsy. Another nice and relevant image to go with it. Fantastic.